Hi, my name is Alessia Fontana. I'm in my third year of biomedical engineering at Wayne State. And in my program, we learn a lot about the medical field and new devices that are used in hospitals in different areas that help with different people needing different accommodations. The article I chose to summarize today deals with the diagnosis of concussions and new developing technology and devices that aid with this. So I found that very interesting that it kind of relates to my field. The title of this article is How Virtual Reality and Sideline Brain Scans Could Help Diagnose Concussions. So a brief overview of my presentation today. I will be giving a quick introduction, talking about eye-sync goggles, the new technology discussed in this article, discussing different current technology being used, and talking about why concussions are different from other injuries and why they differ from patient to patient, and then a brief conclusion. So concussions are very common for athletes, but for soldiers as well, in many different sports like football, hockey, basketball, soccer. But in the NFL last year, there were 291 concussions. So this is a big number that definitely needs to drop. So it's an ongoing issue. And that's why new developing technology is really important to just try and prevent permanent injury and trying to reduce that number of concussions. So in this article, they explain and discuss about a new device called eye-sync goggles. And they're virtual reality goggles that simulate the movement of a spot and track the eye motion of the injured patient. And since concussions normally impact part of the brain that allow the person to predict motion, tracking the eye movement with these goggles can help diagnose a concussion, which is really important and really interesting just because they can track and help hopefully diagnose a concussion right when it occurs. So current technology being used today, other different tests, are changes in speed of blood flow to the brain. So looking at that, looking at a spit test, so looking at the molecular makeup of the spit, as well as hearing test. So since concussions impact the brain, and the brain is very complex, there can be many different symptoms, just as like the hearing, the sight, and it can also differ from patient to patient. Another reason why concussions are different from other injuries is because with an injury like a broken arm, you can definitely see the symptoms. So you can see swelling, you can see deformity, but with a concussion, it really depends on self-reported symptoms. So you ask the injured victim a series of questions, and based on their responses, you can hopefully diagnose whether a concussion occurred or not. But if a soldier or a player wants to get back on the field, they may lie about their answers and responses, and the diagnosis can be inaccurate. So this is a really big problem. That's why new technology is working on making a measurable test. That way, the diagnosis can be more accurate. So with more data that's coming in and more tests being done, new technology hopefully can better perform and be more accurate. Just like the eye-sync goggles, more tests are being done on it, and hopefully it can be used in more and more sports and even in the war. Just because serious injuries occur every day in these sports and in the war, and they definitely need to be treated right away before being seen by a doctor just to determine whether or not they should or shouldn't be continuing their activity. This is my reference, and that is all. Thank you so much for watching my presentation.